in the room and wash my hands. Hello, ma'am. Good morning.
Good
How are you?
morning. Good
Okay, can I know, for verification lang, ma'am, no? Pwede ba lang may bawa na inuman?
afternoon, Janine Mendez.
Janet Mendez. How about your birthday, ma'am?
December 10, 1996.
Okay, so ako di ay si Jet, ma'am. I am your student nurse for today. And today, I'm gonna do an assessment of your respiratory system. Is that okay with you? Okay, so before I will start the assessment, mangutana sa ko nimo ma'am kung naa ba kay problema sa lungs nimo.
Wala.
Okay, so manigarilyo ba ka?
No.
Okay, that's good. So I'm gonna start the assessment by observing and looking your uh, chest, the posterior and anterior thorax. Okay?
Okay.
So provide privacy. So, ang kaan. Ano na ma'am, straight ka, no? So I see that the skin tone is even and I did not see any retraction or bulging of intercostal spaces. Sternum is positioned at midline and straight, and I see that the chest is symmetric. Costal angle is within 90 degrees. Also, her respiratory rate is within normal rate and the rhythm is regular. Nasal flaring is not observed also. At her back, the shoulder and the scapula are at equal horizontal position. The spine is normal with the spinous process appears straight and the client does not use accessory muscles to assess the breathing. And I noticed that the ratio of anterior-posterior to transverse diameter is 1 is to 2, which is normal. And the color of her nail beds are pink. So I'm gonna continue the assessment by palpating your chest, ma'am. Okay? Is there any pain? So when I palpated the anterior and posterior thorax of the patient, she reported no tenderness, pain, or unusual sensations. There is no crepitus, and any unusual surface masses or lesions are being palpated. So this time ma'am, ako ibutan akong kamot, and then ibutan ako, can you say 99?
99.
As I assess for
99.
primitus, I feel vibrations
99.
in the upper regions of the lungs, but the intensity decreases when I went down toward the base of the lungs. Also, when I assess the expansion of chest, I see that my thumbs move outward in a symmetric fashion from the midline when she inhaled. Also, the temperature is normal. So I'm gonna continue the assessment, ma'am, by percusing the intercostal spaces. So again, ma'am, I'm gonna touch again your chest. Is that okay with you?
Okay.
Okay. So when I percuse the anterior and posterior thorax of the client, I observe the resonance, dullness, and flatness and tympanic. Exhale, ma'am, and then hold. Okay. Alright, ma'am, mo inhale ka, mo exhale ka, and then hold. And for the diaphragmatic excursion, it measure 8 centimeter. Okay. So next and last assessment is I'll be auscultating for your breath sound, adventitious sounds, and the voice sound. Okay, I want you to breathe deeply, ma'am. Like, so when I auscultate for breath sound, I heard bronchial sound over the trachea. Between the scapula and around the sternum, I heard bronchovesicular sounds, and all in the periphery, I heard vesicular sounds. and I didn't hear any adventitious sounds. Okay, ma'am. So this time I want you to say 99.
99. 99.
And for the voice sounds, when the client say 99, the voice transmission is indistinct. Distinguish. Okay, so and ma'am, can you see letter E?
E. E.
E. E.
E. E. E. E.
But when she say the letter E, it's very distinguishable. Okay, so one last try. Ihonghong ang 1, 2, 3. Honghong ra.
Diba?
Also, when she whispered the phrase 1, 2, 3, it's very tint and inaudible. The next thing to do, ma'am, is the breast examination. So, before I'm going to start the assessment, so I'm gonna ask you kung naa ba kay histories kanang breast cancer. Okay, sa imong family, naa ba sila kanang kuan? Sa imong any of your family, naa ba yung mga naay nag-breast cancer?
Wala naman.
Okay, so that's good. So, I'm gonna proceed now the assessment by inspecting your breast. Okay, can you put your hands on your side? Or pwede sa imong lap? So the breasts of the client are round and symmetric, and the size of her breast is small. Texture is smooth with no edema. The color of her areolas is dark pink to dark brown, and her nipples are equal in the size and inverted. Also, there's no sign of dimpling or retraction, and the breasts symmetrically hang freely. I don't see any discharge from her nipples also. So now, to continue the assessment, I'm gonna palpate your breast. So what you have to do, ma'am, can you lie down? Okay, so let's assume that this is uh, the body of the patient, and now I'm gonna palpate her breast. So in doing so, I am going to use a circular pattern. So by palpating, so from light, medium to firm. So when palpated, her breast, it reveals smooth, firm, and elastic, and there's no masses are being palpated, and no discharge present when I compress her nipples. So the next one, ma'am, is I'm gonna do an assessment of your heart and the vessels in your neck. Okay, so before I'm gonna start the assessment, so mga tanong ko, ma'am, kung naa ba kay history of heart disease? Okay. Do you experience heart attack?
No.
And how about chest pain?
No.
Okay, wala ara. So, now I'm gonna start looking at your vein, and I need you to lie down at 45-degree position. Na supine position. So, okay. So now I'm looking at the vein right here, but I can't see any pulsation. But then when I elevated the patient from 30-degree to 60-degree, I didn't see any jugular vein distended, bulging, or protruding. So her GVP is 4 centimeter. So when I auscultate the carotid artery, I just hear the pulse. I do not hear any blushing or swishing. So when I palpated the carotid pulse, I feel the strength of the pulse, which is normal, and that should be a 2 plus. So the next one is I'm gonna check the apical impulse, which is visible in the mitral area. Next is I'm gonna auscultating the heartbeat. So I heard the S1 and S2, the lub dub. I did not hear any clicks or extra hard sound, and I didn't hear any murmurs. Her heartbeat is normal, which rate 60 beats per minute with a regular rhythm. Okay, so next one, ma'am, is I'm gonna do an assessment of your belly, just here, no? And I'm gonna start. Okay, I'm gonna start looking your abdomen. The color of her abdomen skin is tan. I don't see any stray or scars or any lesions. Her abdomen is flat and symmetric. The umbilicus is midline at lateral line and it's inverted. Her abdomen didn't bulge when she raised her head. Also, I'm looking for a movement. I see a normal respiratory movement of the abdomen. Also, right in the epigastric area, I did not see any waves of peristalsis. So next is I'm gonna do. Okay, so to continue this assessment, I'm gonna do auscultating your abdomen. So when I ausculted her abdomen, I heard soft clicks. So next is I'm gonna percuse your abdomen, ma'am. So when I percused her abdomen, I heard dullness over the liver and spleen. Also, no tenderness as elicited. Her liver span is normal. Then I heard also the tympani at the last left interspace. Okay, I'm gonna continue the assessment by palpating your abdomen. You know? So from
And then,
when I palpated her abdomen, she reported no tenderness and no masses found.